and welcome back to the Caribbean Rediscovered. My name is Sinfra Sandam, and today we're going to have a topic I believe that we need to talk about in general, much more. We need to talk about it more often within the Caribbean, and that is talking about mental health. Often, they say when you have to when you break your leg, you go to the doctor. We need to stay healthy. The last 2 years, we've been hearing a lot about drink a lot, hydrate yourself, eat well, keep yourself healthy. When we talk about health, we also need to talk about our mental health. And on my Facebook post, on Facebook, I had posted this question about, do we talk enough about this topic within the Caribbean? I know we don't. So even when I posted the question, I know the answer would be, we don't talk about it enough. A lot of times we see it as a taboo to get therapy. We see it as something that should be our secret if something is going on with us. So today, I wanted to talk to a specialist who focuses on your mental health, who you're able to have conversations with if you'd like to have questions about what is going on with me, because all those questions sometimes cannot be answered by yourself, not by your family, not even by your pastor, because often within the Caribbean or within our cultures, we're said, talk to your pastor and he'll help you with all the problems that you have, or keep your secrets or keep your problems within your family. So I have the privilege for us to be traveling virtually again to a new island. We're going to be traveling to Anguilla. It's the first time I will be interviewing someone from out Anguilla, so I am extremely excited. I also have the privilege today of interviewing Dr. Oluwakemi Linda Banks, and she is a clinical psychologist, and she will be telling you about her specialism today. And also I will be asking questions I know you also wanted to ask. And also I just want to get a better understanding of why it is important to seek help if maybe you have some questions or you're not feeling well or mentally you're just having some challenges. So Dr. Banks, thank you for accepting the invitation. And I'm so happy that we can have this conversation. I think it'll be one of the first conversations, many we should have of these, but thank you for being the first that I can do this with.
It's certainly a pleasure.
Been? I asked that to everyone, and specifically, it's almost going on 2 years that we're in this new normal. How have you been in the last year and a half? How has life been for you?
It's been challenging. I've encountered clients who are challenged, and as a professional in my field, I'm a participant observer of what's going on. In other words, I'm here to help people cope with the challenges we face, but I myself am challenged by the present situation. And what that also means is that I get stressed as well, I get anxious as well, because I think all of us are concerned about what's going on with our mental health and what the future holds for us.
Mm-hmm.
So I think clinicians, counselors, doctors, all of us, we're all in this together.
Yeah. So tell us a little bit about your specialism, because I think for a lot of times we hear a psychologist, there's a psychotherapist, there's a clinical psychologist. What is the difference? What is your specialty, and what do you specialize in?
Well, a clinical psychologist is pretty much the type of psychologist who is most comprehensive in her training or his training, because we are trained to deal with people who range from neuroses, which means that they just kind of have everyday problems of living, to very ill people who have formal thought disorders and are psychotic. So we are the psychologists who can deal with people on all the any part of the continuum, from normal, quote unquote normal, whatever that is, quote unquote abnormal, because I would say that all of us have problems of living,
Yeah.
and so we cope with people who have problems of living, and we can cope with people who are very ill and who are on medication. We do not administer medication yet, although some psychologists, because of we don't have as many psychiatrists as we would like to have,
Mhm.
So there's been a move in the US to train psychologists, clinical psychologists, to also administer medication. But I do not administer medication, but I know what the medication is all involved, is involved, because we did have to do courses in psychopharmacology as well as part of our training, so we have an awareness of it. So basically, the psychologists have had 9 years of training. The training is very intense because it has to be with supervision, one-on-one supervision. There's got to be several practical experiences. Like my daughter had just completed her training. She did Canada. She did 3 years in Canada. She did 2 years in the US. Then she did 3 years in England.
Okay.
Most of my training in the US. So we get really immersed in the field.
Yeah.
Because when you're working with people who have all kinds of challenges, it's important for you to be able to design a treatment program that will fit.
Yeah.
I was very fortunate that I went to a university in the US, Pennsylvania State University, where they offered me a very comprehensive kind of training, even including hypnotherapy. And I, as a clinical psychologist, because I knew I was coming back to my homeland and there were no other psychologists here, my daughter has just returned, but at that time there were no other psychologists. I knew that I had to work with adults, with children, with marital couples, with people who were psychotic, people who were neurotic, people who had in workplace challenges, the whole gamut.
Yeah.
So I was fortunate to get that kind of training, and I worked here in Anguilla for alone. My daughter just came back 3 years ago, so I did this from 1986.
Wow! So you're a veteran in the field. Nice.
And at that time too, there were not many clinical psychologists in the Caribbean. There were some in Trinidad and Jamaica. But other islands didn't really have clinical psychologists. And so I actually traveled the Caribbean as a consultant to meet the needs of people in those different islands.
What made you decide to go into this field? What was it? Was it something that you always wanted to do, or what was the push to say I'm going to become a psychologist?
Well, it's something I wanted to do from a young age. I believe that we can help people feel better about themselves. So from a very young age, I actually challenged my mother about things she was saying to me. That I said to her, "You're giving me an inferiority complex." No, I was just like about 12 years when I said this to my mother, so you can imagine how upset she was.
Yeah.
How dare you? But from that age, I was concerned about people and how people cope with life and how people feel about things that other people say to them or about them, you know? So at that time, I didn't know about psychology. I didn't know that the field existed. And so I said I wanted to be a teacher and a nurse. I wanted to serve people, to care for people in that way. So my first training was really as a teacher. I was also in the media too. And I was actually enticed to go further in the media, but I felt that I needed to have a message to share with people on the media. And so I needed to get myself immersed in the training of clinical psychology. At that time, my earlier focus was going to be on child psychology or educational psychology. That's actually my first degree. Education and psychology, but then I realized I need a more comprehensive type of training to work with my people here in Anguilla, because the goal was always to come back to Anguilla. Actually, I was in your home country, St. Martin.
Yes.
When they started the Methodist Art Center, I was one of the first teachers there. So that was a step along the way, you know.
Yeah.
But although I was encouraged to stay there and work with school further,
Home was
I
calling you.
yes, psychology was calling me.
Yeah.
And so that's what I did.
Okay. And I read in your bio that you also, I'm going to read it, you opened up a school. You're the founder of a school endorsed by UNESCO. Can you tell us a little bit about the name and what do you do exactly with that school?
Well, it's all part, I mean, I've pursued many different types of experiences, but they all come together under the theme of helping people be the best that they can be.
Mm-hmm.
I was, having been involved in the Medical Doctor Center, I was impressed by the program there. And when I came back home, I felt that it was important for me to make an input in the education, the field of education.
Mm-hmm.
And that the best way I could do that was to start a school which would be focused on helping children be the best that they could be. To develop a kind of a caring environment where children felt nurtured. And the name Omololu is a Yoruba name which says children are the best gift you could get from God. They are the summit of our achievement. And so I felt that with that kind of message, I could get on board with me people who are interested in helping children to be the best they can be, and parents who wanted their children to be the best, they could be. And so I created a school that had a culture of caring. Children were bombarded with positive affirmations.
Nice.
They affirmed each other. We had a time called Omololu time, which was a special time every week when a child from each class received positive affirmations from their teachers and their classmates.
Nice, nice.
It's so refreshing, so stimulating. And so the school actually was a non-violent school. Mm-hmm. We didn't have to use any punitive methods. We used affirmations and positive messages. And the result of that was that because children felt so good about themselves, they excelled.
I think we can now roll into, a lot of times, I think within the Caribbean, we're not used to talking about our emotions. And I think that's how we can roll into the topic and the question that is often asked. Why do you think that talking about mental health is still a taboo within the Caribbean?
Well, there are basic human reasons for that. We don't want to feel that there's anything wrong with us, quote unquote, and there's that taboo about if there is something wrong with you mentally, it means that you're crazy. We don't realize that all of us, neither one of us is perfect. We all have things that we can deal with along the way. But when someone openly admits that there's a challenge, then people kind of point the finger and they stigmatize them. So people in general want to feel as if, there's nothing to worry about mentally. Yeah. It's okay to have a physical challenge. You can deal with that. But there's this mystique about the psyche, this mystique about psychological problems and challenges, I like to say. Mm-hmm. And so people don't want to feel as if anybody is pointing the finger at them and saying, there's something wrong with you. So that's one part of it. Yeah. The other part of it is that people of us, like us, who have African heritage, we have been taught, that we're not good, that there are challenges that we are not as good as, we're not enough. And so we have been challenged to not state or share that we have anything to worry about, because that again feeds into that feeling that people like us of African heritage, are challenged in any way. Yeah.
And I mean, I talking about slavery, and then we come to the word trauma. I think in the last year and a half, we have collectively been through trauma. How would you say we can actually start with the healing? Because I think in general in the Caribbean, we go through hurricanes. So a hurricane is traumatic, but I don't think it's ever spoken about, okay, well, you need to know when is the time when you think, okay, I'm not feeling well. When should I go and speak to someone? When should I seek help? That's the question I think people often have. Um, what would you advise? What would be your advice about that?
When should we seek help?
When should you seek help? Because a lot of things happen. Maybe a hurricane happens. Now we're going through a whole pandemic. There's a lot of stress going on with you. I think there's certain triggers, certain symptoms. What are the symptoms? What are certain triggers that you would say, okay, now it's time for you to seek help for a professional?
Well, when you're not able to perform the types of daily routines that were easy, that came naturally, that tells you that something is off you, when you're not sleeping well, when you're not eating well, when you don't have a sense of enjoyment of life, when something tells you that something is not sitting right, you know, and you need help to cope. You're not sleeping in the night, you don't have the appetite, and so you know that something is not right, and you've tried the herbal remedies, you've tried the vitamins, you've tried everything. That tells you that there is more that needs to be done, that there's something deeper, and that you probably need to talk about it. In the Caribbean, we also, especially the smaller islands, we don't like to talk a lot because we don't want people to know our business.
Yeah.
Because we feel that they will spread it, they will tell our business. And there's a stigma. It's seen as personal weakness.
Yeah.
If you're not able to cope.
Yeah.
But when you of your own volition realize that you're not coping the way you cope, would have coped in the past, there's an important thing to seek help.
And how does it show up? Because I think what's important to let people know is how important is it for you to deal with your mental health? What are the effects that can have long term for yourself if you don't do that? What are the effects?
Well, the body and the mind is one. We have one body. It consists of the physical, and the soma, and it consists of the psyche. So we have what we call psychosomatic disorders. The body and the mind work in tandem. So if you find that you're not sleeping well, you're anxious about everything, you're jumpy, you just don't feel yourself coping with everyday challenges that were easy. It's important for you to take stock. And you can try the physical route, go to your doctor. But many doctors realize that a lot of people come to them have challenges or conditions which are more related to their psychological state and their physical state.
Yeah.
And so those will then refer people. So you go to your medical doctor and he's not able to help you or she's not able to help you. Most doctors nowadays realize that they can refer people to psychologists or to a counselor of some sort. And that's what they've been doing. So when you've tried that route, you've tried the bush teas, the Caribbean below bush teas, and you've tried the other types of things like going to the beach and walking. These are very good, but usually the challenges with our psyche require a more in-depth type of treatment, which might involve going to a psychologist to talk about it, get some suggestions of how you can cope with it. And sometimes very often people come to me and their very first session, they go away and they feel lighter.
Yeah, because they're talking, they're getting their emotions out and are able to talk.
There's a Greek word, yes, which is catharsis.
Mhm.
It's called, it means emptying. You know, you empty whatever is on your mind, and by virtue of talking it out, sharing it with somebody, it relieves you of that type of rumination that you would be, because when we have a challenge, we talk about it to ourselves all the time. It's always
Mhm.
normal. When we speak it out loud, it kind of validates that there is something to be worked on. Somebody is there listening without any kind of judgment, just unconditional acceptance, and that in itself is helpful.
But
So
then,
as I
go ahead.
go
Sorry.
ahead. So as psychologists, we are equipped with many different types of strategies that will help people, and that's why it's important, to seek the help that you need.
And then, but then somebody would say, okay, but I have my family. I can talk to my family, because if it's about me speaking up, if it's about me emptying what's happening in me, if the person then says, okay, but if I speak to my family, that should be enough. What would you say about that?
It's always good to have the family support. However, our family members and friends have not been trained in the techniques of unconditional acceptance,
Yeah.
unconditional listening, and they will sometimes give us advice, because when people come to us as psychologists, they want us to tell them what to do.
Yeah.
Basically, we put the ball back in their court and we say, well, there are different types of psychologists. There are those who are more directive and those who are more non-directive, and we use the strategy which suits the client. However, one of the main things that works well for a client is to know that they're in an atmosphere where there is no judgment.
Yeah.
There's unconditional acceptance. There is listening. Normally, when you talk to your family member, the listening is like a dialogue as opposed to monologue, right? The person is waiting for you to say what you have to say, and then they say, yeah, that happened to me too.
Yeah.
So the focus is shifted from you. And they will say, well, this is what I did when that happened. No, in psychology, the space is yours completely. We believe that people who come to us are the experts in their own life. We believe that they have lived with themselves all this time, that they know themselves better than you would ever know them. And so it's a kind of an arrangement where it's a partnership.
Yeah.
You come to me, we talk about it, and I try to help you to reframe, what you've said.
Yeah.
So I don't tell you what to do, although I said there are some which are more directive, like cognitive behavioral therapy is more directive. But the whole crux of it is that you want the person to know that you are authentic, that you are there walking along with them because you believe that they know there's this psychologist who named Albert Ellis, who was a pioneer of cognitive behavioral therapy. And he said that people know what is causing their distress.
Yeah.
And like another psychologist who created the whole field of, listening, unconditional listening, Carl Rogers, he says, when you're in a room with a person and they know that you are there and you value them, you accept them, just your presence helps them to feel better about themselves. They feel that they can share with you things they haven't shared with anybody else.
Yeah.
And that you will accept them, you will not judge them. Because in the everyday walk of life, people judge us by their standards. As a psychologist, we do not judge you by our standards. We help you. One of my professors said, we lead you gently from behind.
Mm-hmm.
So we don't push you and say, go this way, but we walk along with you. And we help you to find the answer within yourself. Because that's a very important thing too, because if I tell you what to do and it doesn't work, it's my fault.
Yeah. And I think
But
that
if
might be the
you,
confusing part. People, when they go to therapy, they're thinking you're supposed to give me the answers, you're supposed to fix me. But you're saying, no, it's the other way around. You have to find the answers on your own and be able to. Okay, so that means that you actually, the psychologist is then actually retraining the person on how to think and how to move forward with their life in a different way. Okay.
and I like what Albert Ellis says. He says, people disturb themselves and then they disturb themselves about their disturbances.
That's a good one.
We talked about masturbations.
Yeah.
I must do this. I must be the best person. Everybody must love me. The world must treat me well. Everything must be perfect. And so we have these masturbations.